morning qualifying audience. So Mayara Floss is a Brazilian family doctor, writer, poet, filmmaker, and activist. Currently, she is a PhD student at the University of São Paulo. She created and was an ambassador of RuralSeeds and is an executive member of WONCA. She is a WONCA Working Party on rural practice and member of a WONCA Working Party on the environment. Mayara is also a member of the Planetary MOOC and the Advanced Studies Institute, and creator and coordinator of the Planetary Health and Planetary Health for Primary Care MOOC. She was the junior author of the policy brief recommendations for Brazil of Lancet Countdown 2018 and 2019. She has spoken on women's health at the United Nations in 2018. Mayara is a champion for the health of rural and indigenous people across Brazil. So welcome, and over to you.
Thank you. It's very low, but sound was very low. But I understand that you presented myself, Steph. Is that all right?
So your sound is very clear. I think we just, the masks, we'll just remember to take masks off when we speak through this microphone.
Yeah, and now I can hear you.
Okay, good. The sound should be clearer on the online participants, but we can hear you very clearly this side.
Okay. So can I start?
Yes, you can start.
Okay, thank you. So good morning, all. I'm talking from Brazil, in the coast, in the south of Brazil. It's on the same line, almost like a little bit further down than South Africa. And I'm really pleased to be with you today. I was thinking a lot about this conference. I'm really pleased to be with you, but I would prefer much more to be in presence with you and that we could share experiences and talk and that I really could see you and well, but then we had COVID, and COVID kind of stuck at us in this challenge to be in a e-meeting and in a virtual world. So I can see part of the audience. Can I ask, like, how many of you are family doctors? Can you put your hands up? Okay, and who are students, undergrad students? And nurses? Okay.
So the students are online. Can you see Maraya, or shall I?
I can see them. Yeah, I can see very well. Yeah. Okay, this is there. So what are the health professionals that are here? Doctors. Okay. Okay. I couldn't see very well, but yeah, it's good. Anyway, it's good to be talking with you. Today I will be discussing about a journey to equity and rural health. I create this presentation based in many conversations that I have with Adam. I also wanted to bring a little bit of my world, but also what we have constructed worldwide, and it would be really good to share with you. You can send questions in the chat. I will be very happy to answer, or we can discuss it later. So some people wrote here that there is clinical associates and occupational therapists. Great. So nice to meet you. I hope I can still go to South Africa at some point and then we can meet. I couldn't start to talking with you without showing this picture. I took this picture in the very first week of the pandemic when it reached Brazil. And I'm sure all of you had the experience of looking to the masks and thinking how we'll use it and how long this will go. And the idea in the beginning that everything would be very short and brief, and soon we would be like together and everything. That wasn't really what happened. And it's always very challenging, I think for everybody, but for young doctors as well, that many times we felt more isolated by COVID. I don't know, how do you feel? So just for us to think a little bit of Brazil and where I'm talking from. So we do have 8.5 million square kilometers. We have 2 million people, and I'm born here and I work on the opposite side here on the coast. So I do have my own rural background as well. And but I discovered rural health here in Ireland. I got a chance to be a fellow in my undergrad studies in Ireland, and then I discovered rural health with Dr. Edward Harty. And he was very generous with myself in receiving me, and then like I got a chance to have a glimpse of what was rural health. So I got passionate about rural health in Ireland. So, and it's a very different landscape from my own landscape. When I came back after a year and a half studying NYG in Galway in Ireland, I was really keen to talk about rural health and then discuss this with my colleagues and my professors. But then I got back to my university and they was like, rural health, what is that? What are you talking about? And people didn't know. I didn't have any background on rural health on my own university. So I felt very alone in the process when I came back and I decided that I would be a rural GP. So this was one of the things with myself. This is Eddie. You can watch this movie later and listen it. So back in my country, on my last year and a half, I decided to do backpacking through the primary healthcare, rural primary healthcare of my country. So I discussed it with my course coordinator, and then I created my own rural internship that wasn't available in my university. So I went to crossed all the regions of Brazil from south to southeast and north and all these places. And then this gave me a broad picture of rural and health in my own country. And then I told you that I was feeling really alone. And then I was starting to think, what could I do to feel better or not that alone? And I decided to start a project. I started to talk with some people, and we started a project called the Rural Family Medicine Café, which we start to do calls every month to discuss rural topics, like many topics like social media in rural, isolation in rural, urgencies in rural, women in rural. And then we started to discuss with people from all around the world. And this was a place that I really learned it, like with many discussions, and then people from Africa, from Asia, from Americas, were discussing in the topic of rural. And the idea of the cafe was, or coffee, was that we didn't give lectures, that we sit down in a table, in a virtual table, and then we drink a cup of coffee. And this started a big movement. I have asked help from the Rural WONCA Working Party on rural practice. And they kind of were inviting people to participate. So we had many people participating. And this started in 2015. Later, in 2017, we launched the RuralSeeds. This is myself and Veronica Rasek on the launch of it in Australia, which is a network for young health professionals. We talked about this name because we were thinking about being the seeds of the world to bring the rural into the discussion. When I searched about rural, when I was on Google, when I was an undergrad student, I did it many times. And then rural health, there were references from Australia, there were some references from Europe, there were no reference from Americas, for instance, and at least Latin America. So if I would write a rural GP or a rural family doctor, which will just have men. I was like, no, this is not actually rural health. Rural health is other things that I experienced. So I also wanted to make it more, I use the word fashion, but to make people like rural, it's beautiful. And of course, it's very challenging. And there's a lot of problems that I learned in the way. But it was really about a passion as well. So this is what became the Rural Family Medicine Cafe. Into the conferences, we started to sit together, everybody with the same voice, students, and very high professionals on their careers sat down to discuss rural. And I can say that this changed many things of how we see things, and we can see the participation of many women, and we started to make rural more accessible, at least reduce the isolation. So this is a little bit of a timeline. We have like in October 2015, the first Rural Family Medicine Cafe that run it. And then the Family Medicine Cafe became something total out of control. And then people from all around the world have done local cafes. And then this is something that you can do with students or with your communities to discuss about things together. And then we have the Rural Health Success Stories, what was created with the South Asia Rural Organization. It started there. And I actually invite you all to send stories. We want to share stories, not just beautiful stories, but difficult stories, real stories of the rural world. And then in 2017, we launched the RuralSeeds. We made a call to action of what the students want. At that time, students and young doctors want for the future of the rural. We created a program of the mentor-mentee, which I will be talking more later. And we started also the production of the rural videos. So this is a bit of the projects that's still going on. The mentor-mentee currently not, but the rural health success stories, the rural family medicine cafe, and the rural videos they keep happening. I will share now a video. I will just need to know if you are listening the sound, just for you to see what we have created with this network worldwide. I will try to... Can you listen?
Por que a saúde rural é diferente da urbana?
Okay.
Apesar de parecer que os temas são parecidos e que as visões de saúde podem ser facilmente transportadas do urbano para o rural, devemos pensar que um único tamanho não serve igual para todas as pessoas ou locais. No Brasil, os povos e comunidades rurais são aqueles que têm seus modos de vida e reprodução sociais relacionados predominantemente com o campo, a floresta, a água, a agropecuária e o extrativismo. Existe uma diversidade muito grande desses grupos, cada um com suas especificidades. São camponeses, trabalhadores rurais assentados, comunidades tradicionais, como quilombolas, ribeirinhos, pescadores artesanais e marisqueiras, as que habitam ou trabalham nas reservas extrativistas em áreas florestais ou aquáticas, aquelas atingidas por barragens e muitos outros. Essas populações usam os recursos naturais para sua subsistência, com a mão de obra familiar. E assim, o processo de adoecimento dessas pessoas está relacionado a esse contexto, que difere, em certa forma, do cenário urbano. Mundialmente, existe uma defasagem de profissionais de saúde em zonas rurais e remotas. Enquanto em Manaus, por exemplo, há um médico para 574 habitantes, no interior do Amazonas há um médico para 8.944 habitantes. Assim, vemos que as diferenças entre o rural e o urbano já começam no acesso à saúde. O número de pessoas que nunca foi consultado por um profissional de saúde, por exemplo, é maior em áreas rurais do que urbana. Nesse sentido, ter profissionais de saúde próximos aos pacientes, como acontece na atenção primária, facilita o acesso à saúde. A criatividade no cuidado da saúde rural é marcada, por exemplo, no uso de embarcações, servindo como um posto de saúde móvel e equipes de saúde itinerantes. Na área rural, os profissionais de saúde precisam ser mais resolutivos e ter um leque maior de procedimentos do que em centros urbanos, uma vez que as disponibilidades de outros profissionais e os recursos são mais escassos. Assim, os profissionais devem estar preparados para atender a uma população com perfil diferente da urbana, sabendo que em cada comunidade encontrarão pessoas e histórias únicas, moldadas pelo contexto em que vivem. Por que a saúde rural é diferente da urbana?
I was just thinking if you could read the subtitles. Were you able to read it? Okay, I was just wondering now. Perfect. So that's a little bit of what we have been done, and I think you can relate that we created like a channel on YouTube, pages on Facebook, Instagram, Twitter. We facilitated that many internships from people from all around the world to connect them with health professionals that were working in rural. And I can say, I think we have changed at least the rural world a bit. So getting back to the size of Brazil and my experience, I work in the Brazilian Unified Health System called SUS, and it's a really huge territory. This is the car of after a home visit that I have done in a rural area, certainly. So it's very challenging to be a rural doctor here. I need to be honest with you, there is like 1 or 2 months that I'm now in a urban center. It's not my choice, so I was moved. I'm hoping to get back to rural as soon as possible. So I work for the Ministry of Health of our country, and then I can choose. That's not my choice. But when we go to rural areas, there is on the car when we were moving to a rural area, that's an uncharted region. I don't know if it happens in South Africa that you got your car and then you got like a little bit of a road, and then that part of the road is not on the maps. So this is like how challenging it is to be in a place that is not even in the map. This appeared in my car when I was driving to my rural working place in a remote area. So when I realized that people that live in rural areas didn't have access to health services, I was really sad. And then that was what motivated myself to create RuralSeeds and all the projects that I showed to you. So around 60% of the people that live in these areas do not have adequate access to essential health services that they need. So we are talking about equity and justice when we talk about rural. And then we have a shortage of competent and motivated health workers, and which is the most important contributor to inequity in rural and remote areas. When you are studying any health topic, if you get like, if you start talking about rural, many times you are not listening, at least in my background in Brazil, or you would not be that good health professional. And that's why I'm really trying to work to change that. The best health professionals are in rural areas, because we need to be much more resolutive. We need to have more skills. We do change the life of people if we are there. So just for thinking about a little bit of how important is this equity topic, and how important is to think about how many health professionals we have and the mismatched supply, is that the global economy project to create around 40 million new health social sectors jobs by 2030. But then if we got like how many of them will go to low income and low and middle income countries, we see the problem that many of these will go to these places. So actually we will have more jobs on the health sector, but they will not be fitted for purpose. They will not be going to the low and income countries. They will not go to, they will stay in the upper middle and the high income. So it is a matter of, we will have a shortfall of 18 million health workers to sustain the good health and well-being SDG. So actually this should be the distribution, the green column. I'm not sure if you see my mouse, but the green part that should be how it should be distributed. But unfortunately, we are seeing that things will go differently. So if you work with education, how are you creating these spaces and how the students are living? Because then we are just creating more injustice, not more, and more inequity. 8 of every 10 individuals living below the international poverty line live in rural areas. And I couldn't say that COVID make this much worse, and this make it worse for rural areas again. Recently, in this year, we launched a review of the health workforce development, attraction, recruitment, and retention in rural and remote areas with WHO, and it's a global policy recommendation. It's open access. You can just put on your phone now that you access it. And this is really important. This changed. I think this can have a lot of potential to have the recommendations to change what should be done by policymakers, by governments, and how we can push it. So I decided to bring it because I feel that's a very important document. I was part of the team that was doing the review and after the steering group of this. And I think it's a very important document. So they have done big research to see what it's need for us to have health workers in rural areas. So they created 17 recommendations that go through education, regulation, incentives, personal and professional support. And then what make people to not stay in rural or to leave or to stay in rural, it goes to personal aspects, financial aspects, working and living conditions, mandatory service, career and education related, and family and community. We cannot discuss about a health professional staying in a rural area if their family couldn't stay there. It's very challenging. So we need to create it. I always talk that we talk a lot about urbanization and like having culture, but who lives in rural affects which kind of culture? Do they have theaters? Do they have access to cultural points? So I started to bring the idea of ruralization, that we need to think about rural being interesting for all. Not that they will be a urban place, but that we create rural new perspectives for people that live in these places and for the health workers. So I will show again a short movie. Now it's in English about this guideline, this recommendation.
Why do we need rural health workers? Did you know that almost half of the world population lives in rural areas? This includes populations that live near rivers, in forests, deserts, islands, mountainous regions, and other remote areas.
8 out of 10 people living in extreme poverty live in a rural area. More than half of the people living in these areas are without adequate access to essential health services.
Yet, rural health and access to health services are often neglected in analyses of health status and health system performance. Universal health coverage cannot be achieved without a well-trained, motivated and supported rural health workforce.
Addressing the maldistribution of health workers in countries is key to addressing the pervasive inequity in access to health services in rural areas.
So, what can be done?
Within a primary healthcare approach, health workforce policies and strategies play an important role in not only ensuring better health outcomes, but also in driving community engagement, gender equality, and sustainable economic development.
There is a clear need for a whole of society approach to develop, attract, recruit, and retain health workers in rural and remote areas.
We must invest in development and training of multidisciplinary fit-for-purpose rural health teams.
Enrolling students with a rural background in health workers' education programs, bringing students in health worker education programs to rural and remote communities, having health education facilities located in rural areas, and aligning their education with rural health needs.
We must protect and support the existing rural health workforce by giving them decent conditions to live and work, with access to continuing education, professional development, and attractive career pathways.
It is also important to recognize the contribution of this workforce. To guarantee and ensure healthy lives and promote well-being for all at all ages, we need to have policies to develop, attract, recruit, and retain health workers adapted to the unique realities of rural and remote areas.
The newly updated WHO guideline on health workforce development, attraction, recruitment, and retention in rural and remote areas offers a broad view of what can be done to achieve the global principle behind the 2030 Sustainable Development Agenda and to leave no one behind.
So let's think and act in rural areas
Together.
So this was another video that we produced in RuralSeeds. And can we think together about these rural areas in the world? Can we think together about this change? And I think this document can be used by you as a tool for discussing it. So just to bring in a little bit more about this guideline, the 17 points are that we should enroll students with a rural background in health worker education programs, locate health worker education facilities closer to rural areas, bring students in health worker education programs to rural and remote communities, align health worker education with rural health needs, and facilitate continuing education for rural and remote health workers. So education should be close to rural areas. People with a rural background should be seeing and having their value recognized, and we should have continuing education. Someone shouldn't go to a rural area to work and be abandoned there. We should be connected. We should have like a state interest on that. We should, like on the regulation side, enroll students with a rural background in health worker education programs, expand the range of health worker occupations to meet rural health needs, and ensure that compulsory service arrangements respect the rights of health workers and are accompanied with appropriate support and incentives. We have a lot of problems, like in Latin America, with compulsory service that were not fitting, that were not respecting the rights of the health workers. I don't know if this happens in South Africa. And also we need to tie education subsidies for health workers to agreements for return of service in rural areas and remote. And it should be attractive to be in a rural area, and otherwise people wouldn't go there. And improve life conditions. We should have places that are safe, decent work, with good working hours, not abusive working time. We should create like support networks, which I think RuralSeeds is one of them, the Rural WONCA is another. Develop and strengthen the career pathways for rural, and facilitating knowledge exchange, which I think we have done a little bit on the mentor-mentee, but this is like we should exchange, and that's also important that I'm here, that we can exchange this knowledge, facilitate this knowledge exchange. And people that are working rural should be on the journal, should be recognized all the time for the effort to be in a rural area. I finishing my presentation here. I will do some invitation now. I want that we think a lot about, and that you feel very valued by your effort to be in a rural area. That if you are an educator, that you decide, if you are talking about rural and discussing rural, and I think if you're in a conference about rural health, you are doing the change. And I really want to say thank you to you all that are working in these rural areas. And I will do another invitation. I'm also part of the WONCA environment group, and we created this course, which is completely free with certification about planetary health for primary care. It wasn't the focus of my lecture today, but I couldn't, we live in rural areas, and we work in rural areas, and the people that will be more affected by climate change live in rural areas. So this is one topic that we need to discuss more, and then we create this course, which is completely free. It's programmed by low bandwidth of internet, and the modules were constructed with colleagues from Africa. So I do really invite you to join it. I will show a short video, and I promise that is the last one, but I really think that these images and other voices help us to connect. This is very, very short.
Dear family doctor, nurse, nutritionist, community health worker, actually, dear health professional, I presume that you always want to be the best for your patient. But have you ever thought that maybe you are missing something? When your patient has an acute cardiovascular disease, have you considered the air pollution that he or she is exposed to? Have you checked the temperature of that day? We live on a planet that has changed a lot because of humans. Even COVID is related either to our food production chain, or it is worsened when the air pollution levels are higher. Is your patient depressed or feeling hopeless? Mental health can also be related to how we inhabit Earth. Talking about climate change is urgent. We cannot miss things when caring for our patients. Planetary Health studies how human health is impacted by global environmental changes. Learn more at the Planetary Health for Primary Care course, available for free and with certification. Do not miss things when taking care of your patients, and be a part of taking care of our planet.
Okay. Again, I can send the links
Dear
of the
doctor,
videos.
Nurse.
And so if you want to take a picture to access the course later, it has a lot of an interface with rural health. And it's not exactly the topic, but I also think that when we are talking about climate change and land and rural, we're talking about going back to Earth. And this is really related with planetary health. I have a really special invitation for you. That is the Rural Cafe that we will have tomorrow into the conference. That's Why Rural. And I really hope you can join us, and we can discuss and have a beautiful audience for the Rural Cafe. And I couldn't finish without mentioning that we are living in Brazil a very, very bad political crisis. We do have a far-right government which is taking the rights of people, and mostly indigenous and rural people are dying. This was painted some years ago by an indigenous man called Feliciano Lana, and showing, I think, a little bit of the future, and he died by COVID. So I want that we think a lot about of our networks, of our future, and all the good things that we have constructed, but how fragile can democracies can be, and how urgent is also always be questioning and thinking on the future. And this is much more about my crisis in my country. And I hope on the next time, if I go to South Africa, I can tell a better story. But for now, it's very serious, and it's much more challenging to be a rural doctor now than it was a year ago or 2 years ago. And again, thank you so much. I hope it makes some sense, my jumping from one topic to another. And I really want that we can now have a little bit of a chat and a conversation.
Thank you very much. Lungi, do you want to come and chair from this side, and then I'll keep an eye on the chat on that computer, slightly schizophrenic. So Maraya, what we're going to do, Lungi is going to allocate people who want to speak. They'll come up to the mic here. And I'll keep an eye on the chat to see if there's anybody online that would like to ask questions or contribute.
Thank you so much, Madeleine. Thank you so much.
I can hear now.
Can you hear me now?
Yes.
Such great
yeah.
So much insight, so much to take in. Thank you for gracing us with your presence. For the audience, we had planned for Mayara to actually come out here, but with the travel restrictions currently in place, she needed to do this on Zoom. So thank you again. We apologize for all the confusion with times. I would happily accept any hands from the floor. Madeleine is going to be coordinating any online questions. Please come forward.
Afternoon, Maya. Selma Program, a family physician. Yeah.
Wait, who is talking? I'm not seeing. It's just that it would be better if you can see the person. Okay, thank you so much.
Yes, Maya, I thank you very much for the presentation, which actually gave an idea that in terms of the provision of health and the equity that we're facing, there is not much difference between what's happening in Brazil and what we're seeing here in South Africa. The one question that I have though is in terms of upskilling of the people that are working in the rural areas, what programs do you have in Brazil to sort of address the deficiencies at that level, the rural health level? Thank you.
Thank you. I didn't got your name, but thank you. What's the name? His name?
The name is Temba.
Kemba. Okay, Kemba. Thank you so much. Thank you for your question. What programs we do have in Brazil? There is a very interesting one, and I will focus more on this one. It's called More Doctors. It was a program created in 2000s, and it was focused on providing rural healthcare for rural areas. So it kind of got it picked up like recent graduates, doctors, and then put them on the rural areas with infrastructure, with a good payment, with rights, and all of this. So this was one of the biggest programs that we had. I was thinking if I should bring it into the discussion or not. I decided to not bring, but it's kind of changed how many people receive rural health. I can send some articles for you to read because it was a very important program from Brazil, and we got a support for developing it. It's based on continuing education, so people access a lot of they are obligated, they have a time into the week to access like education, and then they do not have a very heavy working load, and then the doctors stayed in rural. It was a really important program. It was it changed a lot since we have the Bolsonaro's election, which was really sad, because then we lost again around 7,000 doctors that were working in rural areas. But Brazil discovered how to do that. But it kind of, the government didn't want, I don't know, they were able to keep it going in the way that it was shaped on the beginning. But it's a very interesting supporting program, and I don't know if I answered you. Did I?
Sam is happy. Is there any other comments or questions? Okay. I've got a question on from myself. So when it comes to retention, you spoke about improving living conditions for doctors. Can you maybe share your experiences as to how you've managed to do this in Brazil?
Sure. So that's very different from place to place, and this should be like analyzed in the context of that place. If you are in I will use the example from Brazil, okay? But if you are in the Amazon region, and then we are in the middle of the forest in Brazil, you will need the living conditions. We will need to have electricity, a good house, and a boat for you to get a chance to live if you want, and another person to be working in your place for you be able to live and not left the community without a health professional. So this is not something that we have well implemented yet, but we started to question the government and the local government about these things. That's because people go there, work for 1 or 2 months, and then leave because it's unsustainable that you are the only doctor 24 hours, 7 days per week, all the month. That's impossible. So it will need to be adapted. Where I was working, a good living conditions will need also to have internet connection, and this will be a little bit, we can have a range of things like electricity, internet, and safety places, but this will need to be adapted to the context, to the region, and to how we will like live there. So I think it's very different from place to place, and in Brazil it's different from region to region, and but we should use the evidence that we have, and I think this WHO document is very important, because you can say that WHO is recommending that I have adequate living conditions, adequate in place to live. So what the governors can do, or the policymakers can do, because they are obligated to guarantee that for the health professionals.
Thank you. Just a quick follow-up. There's a hand online. Okay, let's go online.
Thank you. This is Dr. Maputimweti. Mayara, I have a question for you with regard to the role that rural healthcare workers can play in ensuring that the environment doesn't get damaged any further. From your presentation, I got the impression that the cost that you are giving for free, the plenary rural healthcare cost that you spoke to us about, was to educate the healthcare workers, especially those based in the rural areas, about how to take care of the patients there, but with regards to the environment as well. So my question is, what prompted this decision to focus on the healthcare workers being involved in environmental factors in the rural? And what impact do you think that healthcare workers can have on the environment in the rural areas? Thank you.
Thank you, Mapuche. That's a really, really good question. I will tell a little bit of the story of the course for answering you. When I start to go to the conferences and I started to talk about rural, and then I started to discuss about things that were happening in like, for instance, Brazil has the Amazon, the forest of the Amazon, which is one of the biggest forests in the world. And basically it was being cutted and burned. And it wasn't really a discussion about how it impacted our health, not just the smoke of the burning, but like losing these important places. And a forest isn't urban. A forest, it's a rural area. The places that we are losing because of climate change, or that we are losing because of the idea of an economy that needs to exploit a lot, that's based on exploitation and not in taking care. This is like affecting us. There is many studies that shows that mental health is being affected, that our cardiovascular system, every part of us is being affected by losing the green areas that we have, the environment that we have. I'm sure that you have your own stories of places that were affected. But then when I went to talk about this, people were saying like, oh, stop, Mayara, you're being too environmentalist. This is not really related to a heart attacks or strokes or even mental health, or this is too broad. That's not like, I cannot do it in my clinic. And this happened a lot of times. I was a junior author of the Lancet Countdown for Brazil. The Lancet is the medical journal, and the Lancet Countdown policy brief were like instructions for policymakers to, urgent instructions for policymakers to do in Brazil. And I coordinate that, I research it, and I publish like articles, and was like studying a lot. And then when I went to talk with people, I was like, it wasn't working. I was like, I was not communicating. So I was really sad, firstly. And then I thought, I need to think in a different way to communicate with these people. So with my colleagues, then we created then I decided I should go to education, and to make some planetary health concept and what I was trying to say more accessible, and then people that could study about that. And that's why I created the courses. It was actually 3 courses. The first one was in Portuguese. Then they translated the course into English. And after, we have created one about planetary health and primary care. And it's really focused for health workers, but actually the first version of the course, I was intentionally doing for health workers. But then I went to a conference, and then a young girl said, she was like 15 years old, and she said, I want to do this course. Why I cannot? And I was saying, you are not a health professional. And she said, but I want to do it. Why I can't? And I didn't have a good answer. So I got back with the team, and then they kind of, we rewrote the whole course to be open to anyone. So it is focused on health, but it is open to anyone. So we had, like, for now, 5,000 people enrolled in the courses. And then now I can see that we can talk about planetary health and how we live in this world and how this is affected for our hands. Our hand is affecting the world, and it's changing, like how I can discuss with people. So rural health has everything related to climate change. It has everything related with planetary health. The word human come from humus, which means earth. We are people from earth. People that are in rural are much, much closer to earth. And we need to think about being humans in this world. It's very naive to think that how we produce garbage, how we buy things are not related to our health. We are polluting the world, we are making it warmer, and then we do not expect that this affects our health. And just for instance, a more concrete example, when the temperature raises at 1 degree, the dengue fever mosquitoes are capable to transmit more. Their vectorial capacity are increased by each 1 Celsius degrees that are increased, because they reproduce more, because they beat more, and this changed how, and then who will be affected for that? It is the lower countries. If you have a natural disaster because of the climate's more unstable, who will be more affected? It is the low and middle income countries. So, and it is the rural areas. So it's urgent. If you someone that plants and works with agriculture, and that they lost the plantation because of there was drought or there is a lot of rain, this person is in a rural area and then they will be losing it. So who is in the forest? The indigenous people, and this is rural. So it is really related to rural areas, and we have a huge challenge as rural healthcare workers with these tasks. I hope I answered you, Maputi.
Thank you, Mayara.
Yes, thank you.
Running out of time.
Sorry.
Something itching. Itching to say something. So just 1 minute.
Maraya, thank you for this enlightening talk. I like particularly that you opened up the course for everyone, because I believe that health is not only a profession or something to own by professionals. We must actually open it totally up to everyone. And here we love to educate people, but yeah, we are still far from opening up enough. I like this idea very much. Thank you to the 15-year-old.
I will add the link on all the links for everything on the chat, and then can I ask for people to share with you? Is that okay? For the course and everything.
Great. Thank you very much.
Thank you so much.
We have come to the end of that session.